Okay, I think I started.
Yeah.
Yeah. So, hi everyone. Thank you for joining our Take Her Places speaker event. So today we have a special guest, Tiffany. Whoa. Whoa.
Hello.
Yeah. So Tiffany, do you want to like introduce yourself to?
Yeah, so my name is Tiffany. As maybe you guys know, I'm Tanya's older sister. Um, I am a fourth year medical student at Loma Linda. Um, and yeah, do you want me to kind of just introduce on how like I got into medicine and
Yeah.
kind of like my journey?
Yeah, just like a brief background on like more about yourself and like your journey. Yeah, that'd be great.
Mhm. Yeah, so I think like most you guys are all from Hamilton, is that right? Okay, yeah.
I
I
think
also
Joyce is from ACP.
Oh, ACP. Okay. So yeah, basically grew up in Arizona, went to Hamilton for high school, and then after high school I went to UCLA for undergrad. I majored in microbiology. There's this really long major at UCLA called MIMG, which stands for Microbiology, Immunology, and Molecular Genetics. I think at that time I really didn't know that I wanted to do medicine, but I knew I wanted to do something in like the healthcare field, whether it be like PA, optometry, but I didn't really decide that I wanted to do medicine until like my junior year of college. So that's where I started kind of researching what classes I needed to take for med school and started prepping for the MCAT. Um, but I ended up taking 2 years off after college, like 2 years of gap year to really solidify if I wanted to do med school, since it's not a short track. I was considering doing research instead, like getting a PhD. So I did, I moved up to Washington to do 2 years of research. And then I decided to apply for medical school in 20, 2019. So I entered medical school in 2020. And now I'm a fourth year. I just finished my interviews and application for residency. I decided on family medicine. So my rank list is due at the end of this month, and I'll be knowing where I match mid-March. And family medicine is 3 years. It's one of the shorter residencies, so after 3 years, I'll be an attending.
Yeah, that sounds so cool. So like, is there a specific reason why you wanted to choose like medicine in the first place? I know you
Mhm.
said yeah.
Yeah, so during college, I had an opportunity to volunteer at a clinic in Skid Row. I don't know if you guys are familiar with Skid Row, but it's like one of the cities in downtown LA that is predominantly a lot of like homeless, underserved populations. So when I got a chance to volunteer there, I was really touched by the compassionate doctors who were kind of dedicating their lives to serve the underserved population and people who are overlooked in our medical system. So that's when I realized I wanted to do something in the healthcare field. There is a shortage of primary care doctors, and that really became one of my, I guess, aha moments where I decided, oh, like this is how I want to use my education to serve people who don't have access to healthcare. And that was my passion ever since then.
Yeah, that sounds so cool. Tanya, do you want to ask next question?
Okay. So we'll just be asking questions, and you can like expand more on it.
Yeah, and then like anyone in the meeting, you guys can add on to any questions that you have at any time. And at the end, we'll like open up the floor for extra questions. So just feel free to talk if like you have any specific questions for Tiffany.
Okay. First one is there anyone who specifically encouraged you to be a doctor, or like have you been part of a mentorship program?
Mm, Who encouraged me to be a doctor? I would say like during my college years when I was volunteering at like that homeless clinic and also doing research at the same time, I had a research mentor who was an MD PhD. So he was doing cancer research and he was also an oncologist. Um, Under his mentorship, it was really good to know like the different facets of medicine. So I got introduced to kind of academic medicine and also by volunteering at that clinic, kind of been introduced to community medicine. So he was really, I guess, also an important role in encouraging me to do medicine and how I can serve people in different aspects, whether it be through research or through um, being in like primary care. But I wasn't part of like a mentorship program, if that's what you're asking. I just like sought out my own mentors.
Okay.
Okay, building on that, so with med school and like surrounding yourself with new environments, how do you think you would recommend like anything navigating through that unfamiliarity?
Sorry, can you repeat the question?
It would be like when you're surrounding yourself in new environments, how would you recommend kind of handling those like unfamiliar parts?
Mm, I think one thing that I learned in being, I guess, not only in med school, but just life in general, you should be comfortable with being uncomfortable. I think there's a lot of things that you don't know and things that you need to learn, and it's okay to seek help, and also ask questions. So that's how I got through med school, at least, just being okay with being looked like I'm stupid and I don't really know what I'm doing. But I think just being curious and having that desire to learn in an unfamiliar environment can get you pretty far. You're not going to know everything, and I think it's pretty impossible to like be prepared for everything. But just, yeah, just being okay with not knowing, reaching out for help, finding mentors, having talking to people who have already gone through the same experiences, and people that you look up to, and just establishing that relationship and asking questions, I would say like would be a good way. Not sure if that answered your question, but
No, I think that was good. Yeah.
Yeah, so going off of that, I feel like this is a little bit more personal, but like were there any like scary parts of making new friends as like you're like moving like new states and stuff? Because I know you came from Arizona and then you went to school in California. So then was there like anything scary about that? And like how would you say like your friends have also influenced you in your journey?
mhm. um, I mean, starting over in an unfamiliar place with no family around is kind of scary, especially coming from high school into college. But I think it just really taught me to be proactive in making friends. I think as you get older, it might be a little more difficult making friends because everyone's just like in a different stage of life or they're busy. But um, you can't, I guess, yeah, you just have to be proactive, be friendly, don't keep to yourself if you do want to make friends. But I think in college it's pretty easy because you'll be in dorms, you'll have clubs, people who have the same interests. So I would just say, like, just take advantage of those opportunities and be open to meeting new people and like learning their stories as well. But, yeah, definitely can be a little scary. Um, and it's normal to feel that way.
Yeah. Yeah, I feel like that was like because all we're all high schoolers, so we'll need to go to college later and like we all have to go through that. So yeah, I think that was really good advice. Is there any like main factors that you considered in picking your university or like residency programs?
Yeah, so a lot of the reasons why I wanted to pursue medicine was because of my faith. Um, my faith as a Christ follower. So I really wanted to go to like a Christian university, and Loma Linda is a Christian medical school. A lot of it has to do with an emphasis on working with underserved populations. So that's what I wanted to do in the future. And Loma Linda had that as well, like opportunities to work at like an FQHC, which is a federal qualified health center in San Bernardino. Um, so there's a lot of like immigrant population, homeless populations who don't have access to healthcare. So that's what I looked for in med school, like opportunities to do like mobile health, work with homeless populations, have a strong emphasis in primary care. And similarly, that's also what I looked for, or what I looked for in working in like residency. So a lot of them that I applied to were primary care focused. Well, I wanted to do family medicine, but also an emphasis on like community medicine as well. So
Yeah, that sounds like great. Is there a specific reason that you went to like California for both of your schools? Um,
part of it is just California. I mean, I wanted to stay in the West Coast. It's pretty near Arizona, and also my husband's family is in NorCal, so California, like Southern California is like a midpoint between those two. So location has to do with a lot of it, and also, yeah, like it's like I said before, it's like a Christian institution, so which is um, there's not a lot of them. So Loma Linda was one of them in California. And also my mom didn't let me go far. So that was the reason why.
Okay, I'm not sure if this was taken into consideration, but what setting are you hoping to practice in the future? Like public or like private hospitals?
Mm. Um, so as family medicine, we're usually typically outpatient, so in the clinic rather in the hospital. So I would want to work at like federally qualified health centers, which is basically like government clinics for underinsured populations. In terms of hospitals, usually community hospitals are affiliated with them. They're, I would say, mainly public. So less of like more of a community setting rather than like a private setting.
Okay. Makes sense.
Oh, so for medicine specifically, do you think there's any obstacles or like barriers to entry that are like specific to medicine that you would have to overcome?
Um, as in like getting into medical school or like
Yeah.
in medical school. Oh, getting into, well, unfortunately, um, medical school is not necessarily the easiest grad program that you can get into. Like you have to take certain classes, take the MCAT, which is not fun and it's very expensive. So medical school in general is very expensive. So just be mindful of that. And certain schools require like certain GPAs or test scores, which um, which may or may like depending on the school, it may like they might not even look at your application if like your score is a certain it doesn't pass like their threshold. So to some people it could be like a barrier. But yeah, it does take a lot of energy and work to apply to med school. Um, and it's I would say some schools are more competitive than others, but generally speaking, like med school is pretty competitive.
So that would be something you would have to like pay attention to and focus on.
Yeah. So um, if anyone's interested in going to medical school, I would look at their AAMC website. They list all the medical schools in the United States and what their requirements are, like in terms of classes, and like MCAT score and things like that. And you can just take a look at that and see, or at least plan your college schedule to match their requirements.
So you mentioned MCAT, right? So do you think you could go over like the major exams like throughout, like on your way to like medical school and throughout medical school that people would have to take?
So, MCAT is I believe it's the only one that's like required for med school. Um, to at least for med school, entry exams, but I'm not sure if you're like an international student, there might be like something else, but at least for US grad, like MCAT is like the requirement. In terms of like other exams, or you're gonna have to pass and take like, you know, your biology classes and other like physics or whatever science classes that you take in college. Um, and then what your question was, other exams during
Like
med
during
school, is that?
like
Yeah, so you're gonna have like your exams in like every med school is a little different. At Loma Linda, it's like you take a cardiology block, so you learn everything about cardiology. At the end of like 2 months, you have an exam on like all like pathophysiology, pathology, pharmacology of like the heart. And then you have an OSCE, so that's like a clinical exam. So they like kind of watch you go in and see like a standardized patient, do a cardiac exam, take a history. They grade you on that. So you have that for like the heart block, the lung block, the kidney block, just all the body systems. That's your first 2 years. And then after your first 2 years, you take the first major like board exam called Step 1. So that's like a 7-hour exam. It covers everything that you've learned in your first 2 years of medical school. And then you do your third year. Your third year is basically you're in the clinic. So you have like a surgery rotation, you have a psychiatry rotation. So you go through the different like general rotations of the fields of medicine. And after each rotation's about like 2 months. And at the end of 2 months, you also have another exam, like a shelf exam that covers whatever you learned in psychiatry or whatever you learned in surgery, plus an OSCE, another clinical exam. Um, and you have that for your third year. And at the end of the third year, you take your another board exam called Step 2. That's a 9-hour exam. Basically covers everything that you did on third year. And then you're done for at least for medical school. And your fourth year is pretty chill. And then you do your first year of residency and you do Step 3, which covers basically everything that you learned in your first year of residency. And then you'll have like your licensing exam at the end of residency to become an attending. So definitely a long journey. And to say these tests actually cost at least $700 each. So your step exams are not exactly cheap. So medicine in general is not exactly cheap, and it's quite tiring.
yeah, so obviously all of those you mentioned were major obstacles. So how would you like find like a balance between like your school and like your personal life?
Yeah, it's a good question. Honestly, you're just gonna have to be pretty proactive and like dedicating time to study and also making sure that you have time for your own well-being, whether it be like sports or like working out or hanging out with friends, because you definitely will get burnt out if you're just focusing on your study. So just being intentional about scheduling time to study, like, oh, I'm gonna take like Saturday to study so I can take Sunday off to hang out with friends. Or so you definitely have to be you definitely have to schedule stuff in order to make sure that you have time for people and time for your own well-being.
Yeah.
Is there any advice that you would give to like high school students who are trying to find that work-life balance and like how we should do that in high school and like college as well? Because like when we get into college, everything like a lot of things are obviously going to change, and like with that change, we also have to like adapt to that as well. How do you think you adapted to that like balance when you were in like high school versus like in college and medical school now?
I would say mainly trial and error. Um, but I think I'm not naturally a person who likes to schedule stuff. I know some people like to say like, oh, Monday, Tuesday, Wednesday, well, I need to do this, this, and this. I'm more of a procrastinator, but that definitely did not work out for me. So, like I would say like scheduling, like I'm gonna really dedicate this time to study for this, and spend my weekends like hanging out, just being very diligent in that. Um, and I think that's like primarily like learning each subject is going to be really different. Honestly, high school, looking back now from high school and college, you have a lot of time. it may not seem like that because you have like a lot of AP exams to study for and a lot of homework, but when you get to like it gets harder as you go on if you're thinking of like medicine, but you have a lot of time. So just make sure that you have time to spend with your friends and family. Because I really didn't think about that in high school. Because I was just overwhelmed with a lot of schoolwork. But looking back, that's like when you do actually have time for family. So just making sure you prioritize your time with your friends and family as well during that time is important.
So I know you mentioned AP classes. So what are some classes or like even extracurriculars that you would recommend participating in for a med school path in high school?
Hmm. So definitely the sciences like AP Bio, AP Chem, AP Physics. Um, that will definitely help you with like getting a strong foundation in the sciences. And also help you getting a foundation in all your like science classes in college. For extracurriculars, honestly, at this time, like I would do whatever you're passionate about. It doesn't necessarily have to be medicine. If you are passionate about medicine, that's fine. Like you can find ways to volunteer at the hospital or I don't know. I don't know what clubs you guys have now, but I used to be part of like Red Cross and UNICEF, like a lot of those organizations. But if you're interested in art or interested in dance or music, go for it. Honestly, I think what makes you stand out in college applications is like what you're passionate about. So don't do things just to check it off, but do things like with things that like you can do establish leadership in and show how you're passionate about certain like hobbies or extracurriculars because that's what's going to make you stand out in terms of for college. Med schools don't really look at your extracurriculars from high school, but you can use that this opportunity to explore different fields and different areas in high school to kind of create like a interest path for like college, and that's when you can actually like really look into certain. I am sure like colleges have more like medical focus extracurriculars that you can be involved in. But as of right now for high school, I would say just do like what you're really interested in because that's going to shine in your application.
Okay. Was there like any other like other than like classes in high school, was there like extracurriculars like camps or internships that you took or like recommend?
Well, in high school, I didn't, I wasn't thinking of medicine or a medical school. So some extracurriculars that I did, I mean, I did badminton, like Tania, UNICEF, Red Cross. I did like a Chinese, I don't know if they have it now, but I took Mandarin. So they had like a Chinese Star Talk, like summer internship where I got to learn Mandarin at ASU for like 2 weeks in the summer. I did like a speech and debate camp. Um, so just very like spread out. I wouldn't like recommend one or the other because like none of them really are medical related, but um it gave me a lot of skills. Like speech and debate helped me a lot with like my public speaking. Badminton helped me with like endurance and yeah. I mean, what clubs do you guys have now? Do you guys still have like Red Cross and stuff or
Yeah, we do.
Yeah.
yeah. Yeah, so you can do like a lot of volunteering. Um, that's definitely going to help you. Volunteering clubs in college is definitely going to help you for med school applications. But yeah, like I said, you can just honestly do anything that you're passionate about. Just making sure that I think college is looking for depth rather than like spreading yourself out thin, being involved in everything, but not really doing much. I think what colleges are looking for is that, oh, like you're in this organization for all like 4 years and you did this, this, and this, you are leadership on this. So I think that says more than being involved in like everything, but having a little depth in it. So
So, you mentioned the MCAT earlier when we were like talking about exams. So before we open like the floor up to everyone to ask you questions, is there like any advice that you have for people who want to go into medical school and like tips for studying for the MCAT and like exams that come with it too? Yeah.
Yeah, so the MCAT, I don't know if they changed it. I know they changed it a little bit after COVID, but it used to be like a 5 to 6 hour exam on physics and chemistry, biology, English, and I think that's pretty much it. So when you're choosing classes for college, making sure that you have a foundation in those classes is would be a good way to study for the MCAT. Um, Everyone's a little different. Some people take like 3 months to study, some people take 6 months, some people take a year. So just depending on like how you did on those classes, you can kind of gauge how much time you need. There are a lot of resources like online, like there's Kaplan books, like I don't even remember what books they have now, but like you can look it up online, like how like resources for MCAT. Like you can go through like a book to review. Some people take classes, like summer classes for MCAT. Um, it just really depends on what your studying style is. But what was helpful for me is to take a lot of practice exams because half the battle of the MCAT is just sitting through a 5 hour exam and without like with little breaks. So you're just reading passages and you need that concentration. So make sure you do a lot of practice exams before the real thing. That's why I think that's the main way that I think how I best studied for it and what helped for a lot of people.
Yeah, so definitely. So does anyone have any like specific questions for Tiffany? Because I know we're like running out of time because like the Zoom meetings, like they never like go on for like what they say they would. So like I think we only have a couple minutes left, but like does anyone have any specific questions?
I know some of you guys want to go into like pharmacy or nursing, so maybe
Mm.
some stuff about that.
Yeah.
I don't know too much about nursing and pharmacy, but I love them because they help a lot in the hospital. The hospital wouldn't run without them. So, um,
Is the schooling like you? So pharmacy and nursing, you would have to go to medical school too, right?
no, it's a
Okay.
different school. So nursing goes to nursing school, pharmacy goes to pharmacy school. So pharmacy is like 3 years. I think nursing is like 2 to 3. I can't remember.
Oh, I think Heidi
Yeah,
asked.
Heidi has a question, I think.
Yeah, were you ever considering other fields for college? In terms of other fields, if you meant like engineering or like subsets in meta in like healthcare, I never really, okay, so I'm really bad at like I can't do engineering, but I did consider business for a little bit since my dad is a businessman and it would be easier to like take over his skill set, but I didn't like it. In terms of like healthcare, yes, I did consider. I was actually really interested in optometry um as another field, but I guess that's under the healthcare field, so I'm not sure if that's like what you're asking. But I did consider like PA and optometry because they were shorter. Um, they were focused on like kind of more like the optometry, obviously the eyes, but PA was like you kind of do similar things as a doctor, but in a shorter amount of time. And how long does medical school and residency take in total? Medical school is 4 years. Residency, it depends what you want to be. The shortest is family medicine, internal medicine, and pediatrics. So if you want to be a kid doctor, an adult doctor, or you want to see everyone, that's 3 years. The longest residencies are the surgical residencies. So neurosurgeon is 7 years. The 4 plus 7, 11 years. Some people take extra year for research, so it could be like 11 to 12 years of schooling. It just really depends on what field, particularly.
Okay. We only have a minute and 30 left, so I think if that's all the questions.
Yeah. Is there any like general advice that you have to like people who are going into medicine?
Mm. Yeah, so in medicine, it's common and it's unfortunate that when people go into medicine, they kind of get sucked into medicine. So just be mindful that there's a world out there. Pursue like other interests as well. It's really easy to kind of get sucked into the pre-med life. So that's the best advice I can give you. If I can go back in time, I would love to explore like other stuff like arts and things like that. So those things are you might consider like useless for medicine, but I think it's like I think it's useful actually. Like there's so much more to life than medicine, and it's a good way to like connect with your patients as well.
Yeah. Yeah.
Thank you so much for
Yeah.
coming and
Thank
speaking
you
for
so
us.
much, Tiffany. And
Oh
like
yeah.
thank you to everyone who attended.
Thank
Yeah.
you.
Thanks for having me and feel free